Welcome to our channel Film Fiesta. Today we are going to see the reason why Doctor Strange became wizard, so stick till end and enjoy the video. The scene unfolds with a focus on a 35-year-old Air Force colonel who has suffered a catastrophic injury, highlighting the urgent need for specialized care and expertise. As the clip begins, a doctor is on the phone, inquiring about the colonel's condition. We learn that he has experienced a serious mid-thoracic burst fracture due to an incident involving experimental armor. The urgency of the situation is palpable, as the doctor expresses a desire for a case that will truly test his skills, indicating that he's looking for a challenge beyond what many other doctors could handle. This sets the tone for the high level of competence and specialization required in the field of neurosurgery. The dialogue shifts to another patient, a 68-year-old woman diagnosed with an advanced brain stem glioma. The doctor's reluctance to take on her case is clear. He fears it could jeopardize his flawless track record. This internal conflict reveals the pressures faced by surgeons to maintain both their reputation and their professional integrity. The tension builds as the doctor learns about a 22-year-old female patient who has been struck by lightning. She has an electronic implant in her brain to manage schizophrenia, and her condition intrigues him, presenting an opportunity for both challenge and potential heroism. Transitioning from the discussion to a clinical setting, we witness the aftermath of a car crash involving the female patient. The doctor reassures her, indicating that she has been rushed to the hospital by helicopter. However, he also acknowledges the unfortunate reality that the golden hours for treating nerve damage have passed during the delay in transport. This moment illustrates the critical importance of time in emergency medicine and the dire consequences that can result from delays in treatment. As the scene progresses, we see the doctor assessing the extent of the damage. He details the patient's injuries, mentioning that she underwent a lengthy, 11-hour surgery involving the placement of 11 stainless steel pins in her bones and multiple torn ligaments. The severity of her nerve damage in both hands is emphasized, showcasing the devastating effects of her injuries. This moment serves to highlight the delicate balance between hope and despair that doctors must navigate, as they confront the harsh realities of trauma and recovery. The doctor's frustration is palpable as he reviews the surgical outcomes, feeling that despite the extensive efforts of the surgical team, he could have done better. This reflects a common sentiment among medical professionals, who often grapple with the weight of their responsibilities and the lives that hang in the balance. His emotional response adds depth to his character, portraying him as not only a skilled surgeon but also a deeply empathetic individual who cares profoundly about his patients' outcomes. Overall, this scene encapsulates the urgency and emotional weight of emergency medicine, illustrating the challenges that doctors face in high-pressure situations. Through the interplay of dialogue and visual storytelling, the clip delves into themes of expertise, accountability, and the relentless pursuit of excellence in the medical field. The stark realities of trauma surgery are laid bare, reminding viewers of the fragility of life and the dedication required to save it. As the scene concludes, it leaves audiences reflecting on the sacrifices and struggles of those in the medical profession, particularly in the face of overwhelming odds.